All right, good afternoon, everybody. Hope you had a good weekend. Here with Josh and Paul and Tim Restel. He is the president of the Yard Goats, Connecticut's professional baseball team, and we're getting back to baseball. We'll talk about that in just a minute. First, the COVID, not daily summary, but it's going back since Friday. I think the good news you see on this chart is that unlike Michigan, unlike Idaho, unlike some places where there could be a bit of a spike as they've seen, not in Connecticut, not in our region. We continue to have a positivity rate, less than 3%, lowest that we've been now in a month on the 7-day average. Hospitalizations are pretty stable. Fatalities, tragically, you can see we surpassed 8,000 deaths. 8,000 deaths over the last year. Next up, but we're doing relatively well and flattening the curve when it comes to infections, when it comes to hospitalizations and fatalities, because people are getting vaccinated. We're doing very well on that front. You probably saw the United States was celebrating, yesterday that over 50% of their adults, our adults, had been vaccinated. Well, our adults in Connecticut is not 50%, it's 61%. All of you have had at least your first dose, all of you over the age of 18. That's extraordinary good news. 65 and above, they're the champion age group. 88% have been vaccinated. Gives you some confidence that if we can move those other numbers up for the 18 to a 44-year-old age group, we will have herd immunity and be back to a really great summer. And so far, the numbers look good. You know, Josh has told me some of the mobile vaccination vans, they have some extra vaccines at the end of the day. It's worth checking. It's worth stopping by. There are same-day appointments. You can go online and you'll find there are appointments available. You may have to hunt and peck depending on where you are, but there is more capacity now, and here's your chance to get vaccinated. That means we have to work a little harder to make sure each and every one of you gets vaccinated, and that's why we have a partnership with 144 community partner organizations doing outreach, knocking on doors. We have the LEAP organization, they're knocking on doors, telling you to get vaccinated, how to get vaccinated, bringing vaccines for those who are homebound, also telling people about the summer camps and other programs going forward. Working with the large not-for-profits, Red Cross, Salvation Army, community centers, faith-based organizations. I love the front page of the Hartford Current today about two sisters, Muslim sisters. Headline was, "They trust me." You have to have trusted advocates going out to the Muslim community and getting people vaccinated. Young sisters take the lead is the headline. Thank you for what you're doing. Our mobile vans continue to bring the vaccine to you. And you can see here 10 mobile clinic destinations, Hartford, Bridgeport, New Haven, New Britain, Waterford, East Hartford. And you say, hey, these are all the big cities. Well, these are where we have a lot of socially vulnerable populations. It's really important we bring the vaccine there. And we've been to an additional 26 smaller towns, really making sure that we get the vaccine to you. This chart, an eye chart, I appreciate it, gives you an idea where the vaccination mobile vans have been. Again, the Naugatuck Valley, you can see that a little bit, in and around New London, Norwich. But we're making pretty good progress. You don't need an appointment. You can just stop in. And if you don't want to find out when the van's going to be in your area, just contact your first selectman. Go to the mayor's website. You'll be able to find out there. So that all leads us to our business restrictions and continuing to slowly, cautiously, and safely reopen our economy. And that started on May 20th last year, we did for outdoor dining. So now, starting May 1st, which I think is a week from Saturday, a couple of things. One, we have an 11 o'clock curfew, move that back a little bit to midnight, gives restaurants an opportunity for second seating, which they greatly appreciate. Makes us parallel with what's going on in New York State, certain symmetry there. In outdoor restrictions lifted. Alcohol without food allowed. That sounds a little like a bar where you can sit, have a drink without necessarily having to have a meal right now. strongly recommend being outside. I think May 1st, you're going to find it a lot warmer, being able to do that outside. And no table size limit. We were, capped at 8. We're going to lift that as well. Continue to be cautious with the mask. Obviously, if you're having a cool frosty, you don't have to wear a mask. If you're able to socially distance, you don't have to wear a mask outside. But otherwise, stay cautious on that. And then moving forward a few weeks to May 19th. At that point, we're going to essentially end all the remaining business restrictions. And what does that mean? That means the social distancing will be relaxed. It'll be guidance. It'll be up to you and your restaurant how you want to do it. Keep people safe, but no mandates from us. The curfew, we'll lift that, then 12 o'clock curfew. Use your discretion from there. Gathering sizes. We have limits on gathering sizes, indoors and outdoors. Outdoors is 100. That's going to, we'll relax that. There won't be any gathering size limitations after May 19th. And movie theaters, right now they're capped at 50%. They'll be 100%. And at that point, I think there won't be any requirements regarding masks outside. We still strongly recommend wearing the mask inside unless you've been vaccinated. We'll find some balance there that makes pretty good sense. I think these are all ways that we have earned the right to get back to our new normal. And I think you see on May 1st, there's going to be a little more outside fun, which I appreciate as long as we're careful. And on May 19th, we're, back to our new normal. With that, let me just say, the Yard Goat Stadium has been a vaccination center for some months. They've been incredible community supporters for us, the Yard Goats and Stadium. And pretty soon, May 11th, I think it is, Tim, going to start playing baseball. And Tim's here to tell you a little bit about what that means, why I'm so proud that we've been doing the vaccinations. We've earned the right to a live baseball game in person. I plan to be there. Tim?
Governor, thank you. Well, as someone that watches this every week, and as a father and as a husband and a son and an employee in a company, I'm excited to be here today and to hear this news. It's the Yard Goats. We've always said it's been more than baseball. And about 12 weeks ago, the city of Hartford had reached out to us and said, can you host a vaccination site at the ballpark? And we said, absolutely yes. And it's been a great process. It's been a team effort, and it's taking our staff, the city of Hartford, and everyone involved to be able to help us get back to this phase. So I can't stress how important it is to be able to get vaccinations and get back to a new normal. It's, when May 11th comes around and that first pitch is thrown, it'll be 621 days since the last time the Yard Goats have taken the field. So here at Dunkin' Donuts Park, we are preparing for fans to come back into the ballpark. We put our tickets on sale next week for individual tickets, and we're excited to welcome everyone back to our home, to be able to, cheer on the Yard Goats, see the shots in the arms going on, and also getting shots outside the ballpark. So thank you so much for having me here today, and it's an exciting time.
Thanks, Tim. Leave that up for 1 second. Steam Burgers, Hartford. I love that in the background. We've been fussing about pizza. What's our state food? Steam Burgers, that's ours. We should remember that. And the Hartford Yard Goats. No goats, no glory. All right, let's take your questions.
NBC Connecticut.
Happy Monday, everyone. Governor, regarding the loosening of restrictions for May 19th, I just want to be clear on this. So all restrictions go away, save the indoor masking, no mandates, just recommendations. So as in bars and clubs can open indoors with no capacity, Yard Goat Stadium can open to full capacity?
That's right. I think we're going to mandate that you continue to wear the mask in school through the end of the school year. It gives students and teachers and parents confidence there. I'll have a discussion with the legislature about that. And probably we're going to require indoor masking a little bit longer unless you're vaccinated in, crowded public places. But that's it.
And in terms of vaccinations, how would that go about? Like, do people need to be vaccinated to go to a Yard Goats game? Is there any sort of requirements on that end that's been discussed?
No, there are no requirements on that. Different venues may have their own rules, but there are no requirements there.
And then, days after the J&J pause, Hartford had noticed a lower amount of walk-ins at one of their pop-up clinics. Are you noticing that around the state? And then also just wondering what's the latest with the J&J news as well?
We are noticing a little less demand on some of our mobile vans, as I said before. That may be because we're supply and demand are a new mix, maybe a little bit of hesitancy related to J&J. I think J&J, I just heard Dr. Fauci, like everybody else, he expects a decision probably by Friday, certainly this week, I hope.
Thank you so much.
Fox 61.
Hello, Governor. Quick question for you. We announced today that, we are expecting students to be back on campus in the fall. We just heard from Wesleyan last week, Yale this week, that they are going to be mandating that students who go to campus get vaccinated. Do you see Connecticut as, with our public universities making any of those mandates?
Not yet, Amanda. You know me. I just said we got 88% of our people in the older age group vaccinated. If we could do this on a voluntary basis, we will. But if we can't, we'll have to make up our mind on that a little bit later this summer.
Thank you. And one other question for you, a little off topic. We just heard about the 19-year-old being arrested in that awful case where the 3-year-old died in Hartford. There have been calls to your office and just, with state leaders to get more funding for violence prevention programs, some specifically targeting youth. What do you think as a state we can do to, I don't want to say completely solve this problem because who knows if it can be completely solved, but do things to help this process?
Yeah, Amanda, we provided significant funding for our not-for-profits like Project Longevity down in New Haven over the course of the last year, and we are going to double down on our efforts there. We're going to do everything we can to make sure you have the services, the wraparound service, along with the police protection to do everything we can to keep you safe.
Thank you.
NBC Connecticut. News 12 Connecticut.
Good afternoon, Governor. Since people under 16 won't be vaccinated, but their parents and older siblings will be, are you going to suggest that if they're at a business or at an event that masking is more important for the non-vaccinated younger set?
I would urge them to be cautious, absolutely. Maybe they don't suffer particular complications from COVID, but they can certainly transmit it and potentially infect others. And I'm going to do everything we can. We've got to limit the infection because every time there's another infection, there's another chance for a variant. So we're going to watch that very carefully.
And do you have specific goals with this latest set of business restrictions being lifted? And is there any portions of it that give you the most concern or want for caution?
Yeah, when you have drinking outdoors and without much of a curfew, there's room for a less careful behavior. But I really think this is the time we can do this. I think we can do it safely. And because we're doing it outdoors, I have a great deal of confidence. We're going to be in May. I think it'll be really comfortable to be outdoors and safe to be outdoors.
And last question, do you think that when all of a sudden people are able to do things they haven't been able to do in a year or more, do you worry that there'll be almost like a rebound effect, and do you have contingencies in place for that?
I don't know. You pay me to worry, so I guess I worry about a lot of this, but I've looked around the rest of the country. I think we're going to be able to manage this. I think we're able to manage it because it's outside. But obviously what we want to do on May 1st and what we want to do on May 19th is subject to looking at the numbers, looking at the infection rates in particular, and looking at hospitalizations. But so far, over the last month, 2 months, we've been going in a good direction.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, just kind of following up on that question. I think a lot of us were looking at states like Texas and Florida because they were one of the first to really relax their restrictions. As you were looking at the progress that was happening there, did you see anything that kind of gave you hope when making your decision about our state?
Outside. I think an outside culture is relatively safer than being indoors. I think we had a spike, Thanksgiving, Christmas, January. That's not as much a risk in those warmer cultures like Texas and Florida. Now we're going to be May 1st. I think outside gives us some confidence, a little like last year.
And Governor, talking about Texas, they're seeing a 5% increase in cases since April 1st. Should we expect a similar bump, not necessarily a spike, but a bump as we further our reopening?
I don't think so. Obviously, we're going to watch it like a hawk, and I don't have a crystal ball. But I like to think we're opening cautiously. Look, they tore off the mask. They said let it rip. They gave people a certain disregard for the protocols. We're not doing that. We're saying I think we've earned May 1st as a time we can be outside and have a cool frosty with some friends around a table. And let's see how it goes. Assuming it goes well, May 19th, we can open up some more.
Thank you.
WTIC 1080 News.
Hi, what's the latest from the feds on Johnson & Johnson?
What little I know is what I heard from Dr. Fauci, which is they're continuing to look at it. This very narrow subset of people that maybe have a 1 in a million chance of the blood clot. And they're probably going to make a determination about getting it back on the market and available probably by the end of this week.
Josh, you have anything new on that as far as the numbers?
Nope, just what the governor said.
And Tim, the May 19th plans for lifting business restrictions, does that change the plans you announced last week for selling tickets in pods of 6 and social distance and all that?
It does. We will, with opening on May 11th, we will, continue with the pod selling through till the 19th. And then at that point, we will open up the sections of the ballpark for individual ticket buyers.
So back to sellouts after May 19th?
Absolutely.
News 8.
Good afternoon. Governor, some of the things that you talked about right from the start, 61% adults with at least one vaccine compared to 50% around the country. You had talked from the beginning, from last year, about science dictating a lot. And it seems like the science, in a lot of ways, has dictated what you've announced today. Is there also an element, whether it's from the CDC or elsewhere, a bit of forecasting, whether it be looking at what's happened in Europe already, or is forecasting the ability to look ahead and predict also part of this?
I think so. I think the vaccines are working. I think we're getting about 10% every week of the younger demographic vaccinated. So by May 1st, you're going to see a lot more people vaccinated. You mentioned what we see in Europe. I focus a little more on Britain and Israel, where a higher percentage of their people are vaccinated, and they've been able to reopen safely. I'm afraid France, Germany, and Italy are in a very different situation, in part because they're not getting vaccinated.
You also, someone asked you also about with respect to colleges, and the fact that you're not asking people to or mandating that they have the vaccine before going back, is part of that to remain consistent with the other things that were announced today?
I've generally shied away from mandates in areas like this. We're taking the mobile vaccination van to every single college and make sure those kids at least get their first shot before they go home. I sent a letter to every other governor and said, I hope you do the same thing. I don't need kids going back and forth from college as a super spreader event. And I think we're going to know by July whether young people are getting vaccinated in numbers that mean we don't have to require it. If that's not the case, we'll take a second look.
And for Tim, if I may, Tim, this is Rich Coppola. Tim, it's been just an unbelievable success in so many ways since the first game, when the park opened. How much, beginning on the 19th now, when you get into your schedule, there won't be, I'm assuming now, any restrictions in terms of 50% capacity, 75% capacity. It'll be capacity?
Yeah, there'll be some areas that we've blocked off for player access because the players will be on the field, but it will be back to capacity at the ballpark. We will still have additional hand sanitizers. Our health and safety protocols will be in place where we're doing touchless ordering. We'll be all the cleaning, extra cleaning of all the touch points that people use, and just continuing to make the ballpark a safe place where fans can come out, have a great time, cheer on the Yard Goats, and enjoy the day at Dunkin' Donuts Park.
Thanks, Tim.
The Associated Press.
Thanks, Max. Good afternoon, everyone. I just wanted to go back to the May 19th date. Will indoor bars, be allowed to operate? I was just a little confused by that.
Yes. Indoor bars can operate with the mask requirement, yes.
So the mask requirement would be if you're not drinking, then you have to wear it?
That's
or if
right.
You can't
Or you're
distance?
between tables, or you're walking around, sort of the same mask guidance we have right now. Whether it's a mandate or guidance, I'll figure that out with the legislature in the next few weeks.
And what things will businesses have to decide on their own? And I wonder, too, if some of these businesses would probably like to have the backup of the state saying that you have to do it. Like, what if there's a business that still wants to have a mask requirement indoors?
Look, I think businesses have all the freedom in the world to do everything they can to give their customers confidence, 100% confidence. And if they want to have a mask requirement, if they want to say, I want people to get tested, if they want to say vaccinations, that's up to the business, that's up to the venue. What we have is a set of minimum requirements which you think are necessary to keep the state of Connecticut safe.
But indoor masking will continue, say, if you walk into a grocery store on May 19th.
I think so. A little bit longer.
But it's not a definite? You said, I think so, that's all.
I think so. Like I said, Sue, whether it's a mandate on May 19th or whether it's guidance, I have some discussions with the legislative leaders. They're weighing in. May 20th, the executive orders, are even more subject to their review. So I'd like to have their weigh in on that.
Okay, thanks you very much.
Thanks.
The Day of New London.
Hi, everyone. This is Sten Spinello with The Day. Governor, a little off topic, but I wanted to ask you about the state's unemployment rate. In March, it was 8.3%, which was tied with a few other countries for third highest in the states for third highest in the country. Do you know why the rate was so high, and how do you plan to address it?
Well, first of all, different states have different counts, but our unemployment rate is high. And that's, yet another reason that I think it's really important that our hospitality sector, including, the opportunity to have a drink outside, is one way we bring our cities back to life, one way we get our retail back going again, and give people a little more confidence that we're going to get our economy moving.
Okay, great. So are you thinking about anything else other than obviously what will be a boon in opening up precautions in May?
Not really. I mean, obviously we kept manufacturing open. We kept construction. So our GDP stayed high. It was in the service hospitality sectors where a lot of people lost their job during the peak of the pandemic. And you can say maybe I've been a little cautious as we reopen, the service economy, but I think you can see over the next few weeks we're going to be back at virtually 100%.
All right, thanks. Appreciate it.
Connecticut Public Media.
Say there happens to be a surge in one city, like Danbury, following this complete reopening. Is it going to be up to the towns to put restrictions back in place, like we had earlier in the pandemic when a town was in a certain red or orange zone, they could roll back? How do you envision controlling any spikes in some areas once we do fully reopen?
Well, I'll start with that and then pass it right over to Josh. But if I saw a surge, and like we saw a surge in Danbury some months ago. We're going to come in with the reinforcements. We're going to do a very aggressive vaccination program, do everything we can in terms of track and trace. We found that we're a relatively small state, so we haven't changed restrictions town by town. When it comes to putting in the necessary emphasis to get that vaccine in place, we'll double down. Josh, anything else on that?
No, I think that's exactly right, Governor. As we've done throughout, we'll continue to partner with local communities as needed to help them in whatever ways requested. But as the governor alluded to at the end there, the most important thing is to keep driving forward on the vaccinations, right? That's another key factor in these decisions is the success we've had thus far with our vaccination program and the momentum that we continue to enjoy. But, we are at the point where, we're seeing, as we predicted, as we get to late April here, more supply than demand in some certain parts of the state now. And so we really strongly encourage people to continue to go out and get vaccinated, because that is by far the best way to make sure we don't have little flare-ups in certain parts of the state as we go forward.
Thank you.
The Waterbury Republican American.
Thanks. Maybe could follow up on that. Josh, could you tell us what parts of the state are seeing supply outstrip demand?
Well, you can go on VAMS, and you can look for yourself. I was on this morning. I saw a handful of sites where I could have gotten a same-day appointment to get Pfizer or Moderna vaccine in different parts of the state. I saw CVS had some appointments available. And they're most of them, I don't want to overstate this either. I mean, the vast majority of them are still filling up very quickly. We're still vaccinating, over 47,000 people on Friday, I think, received vaccines. So we're still going really strong. But you're starting to see a little bit of slack in the system right now. So, if people are waiting, if they were waiting, I'd encourage them to re-engage, call the United Way 211 line, or go on VAMS or go on any of the websites that they've been checking. I think you're going to see in the coming week to 2 weeks, a lot more flexibility in your local neighborhood pharmacy. Maybe some of those were the sites that were getting gobbled up really fast over the last several months. It's just going to get more and more convenient for people to get vaccinated. The mobile units, as the governor described, are all over the place. So, we're going to see more of that, though, as we go forward to the next couple of weeks.
So how many people are we, vaccinating on average on a day or a week? Do you have those figures? I know you mentioned 47,000 on Friday.
Yeah, exactly. I mean, that's close to the high water mark we've had throughout this vaccination program. So we're still going very strong right now, and hope to continue that for several more weeks until we really get those younger age groups up into the higher percentages as we'd like to see.
Okay, and Governor, and maybe Josh as well. I was just looking at some of the case numbers, and doing some real quick math while you guys were talking earlier. It looks like, in March it was about 1,000 new cases on average. In February, that jumped down to about 960 in March. It's up a little over 1,000 for the first, so far through April. When do you expect to see declines in the number of infections, where we see maybe down to 500 as opposed to hovering near 1,000?
Yeah, that's a good question, Paul. Look, obviously the B117 variant is much more infectious, so they're still infecting a fair number of people, about 3% or so, in that coterie of the 40% who have not yet been vaccinated. So that's a small group where you still have a fair number of infections. I do hope that vaccinations largely solve that and get that down to a much lower number. I'm not sure it'll ever be zero.
Okay. And speaking of vaccinations, there's the House is meeting today to looks like they're going to on their way to passing a bill that would repeal the religious exemption. I know we've been asking you several times, almost every time we get a chance to ask you. So just sort of would ask you again, what's your position, what's your intention if this legislation should arrive on your desk?
I would sign it, Paul. I mean, we have learned over and over again over the last 6 months that vaccinations work. Vaccinations keep me safe, keep you safe, keep my classroom safe, and prevent replications of other variants out there. So it's really important. Look, people deserve a medical exemption. I understand that. Some people are at risk if they get vaccinated. Otherwise, I'm ready to support that bill.
Okay, thank you very much. That's all from me.
The CT Examiner. Hearst, Connecticut Media.
Thanks. Hi, Governor. Julia Bergman. Can you provide some detail on the input you solicited from public health experts in deciding to return the state to this new normal? I imagine Commissioner Gifford was pretty closely involved.
Yeah, I listened to Commissioner Gifford and to David Lehman, Public Health and Department of Economic and Community Development. We try and figure out what's the safest way we can continue to reopen our economy. Something we started May 20th, and with a couple of blips, we've done it, I think, pretty consistently. So Deirdre obviously talks a lot to other public health experts around the state. I got to get her on the next one of these to hear her talk through her thinking about how we proceed.
And you mentioned that you want the legislature to weigh in on the indoor mask mandate. What's the latest with the conversations between your legal counsel and them as far as going through the executive orders?
Yeah, I'll hand this over to Paul, but my understanding is Nora Danahy has narrowed down the executive orders we need to continue after May 20th from a strict public health point of view. And she's working through legal counsel on both sides of the aisle, and they'll probably come back to us in the next couple of weeks, maybe with some recommendations or hopefully an agreement to continue that on a ongoing basis, maybe month to month. Paul, anything else?
No, you got it right on the wall, Governor. As the governor stated, Nora has been working very closely with the Legislative Council. As you know, with April 20th upon us, we're going to be narrowing those the orders down accordingly as we start to build up to May 20th, where there's obviously going to be a lot of legislative input as the governor has asked throughout this process.
Thanks. And then lastly, Governor, I just want to ask you about the latest with the public option, both the bill that's making its way through the legislature and the I guess you could call them threats from the insurance industry in regards to the proposal, or how would you, I guess, characterize their comments?
Well, Julia, first of all, what we all agree to is we got to do everything we can to bring down the high cost of health care, or at least reduce the rate of increase. I know what it means to small businesses, working families. I know what it means to the taxpayers of the state of Connecticut. So that's absolutely vital. As you know, I've really focused on the increasing cost of pharmaceuticals, drugs, as a way to slow that rate of increase, and doing that in association with Massachusetts. So as I look at that's what the most important item is to think about. Be it, the public option, I just say a couple of things on that. I mean, one, whatever they come out with, they got to play by the same set of rules as all the other insurance, health insurance out there. We can't cut corners and have favorites out there in any way. And secondly, I do feel very strongly about this because over the years, the taxpayers of the state of Connecticut have picked up an awful lot of unfunded liabilities, things that we thought were going to pay for themselves. Let's say pensions, for example, that didn't end up paying for themselves. So I'm going to be very firm on the fact that whatever comes out of the legislature is not going to be backstopped by the taxpayers of the state of Connecticut. We cannot take all that risk on our shoulders.
And your comments or your thoughts on the comments from the insurance executives last week?
Oh, we're going to work through this together. We're one state. I don't need a lot of threats back and forth. We're going to be good partners going forward.
Thank you.
The Connecticut Mirror.
Governor, is there anybody who you consulted with in the healthcare profession that suggested that this was ill-advised to go to this full extent of essentially ending the emergency on May 20th?
Not really, Paz. I mean, I think you know sort of some of the people I informally talked to, and you should follow up with Deirdre because she can give you some insights as well. I think we know where we're going to be, I think, on vaccinations on May 1st, and I think you'll find a much higher proportion of our younger folks vaccinated. Our age group, we're already doing pretty well. And I think that was important, and that gives us a little bit of breathing room towards May 19th. May 19th is the day before May 20th when the executive orders go. And May 19th also allows the major events to start planning for June, July, and August. And I think we owed them the clearest indication we could of what our thinking was going to be.
In Boston, will the Red Sox be playing at full capacity in May, and will the Yankees be playing at full capacity in New York?
Well, Tim can speak to this. He was explaining to me that whether we're at full capacity or not, Major League Baseball has their own rules, and they will follow those rules. Tim, you want to speak to that?
Yeah, I mean, I can't speak for other teams and other in other cities and states, but I know a lot of minor league baseball operators have reached out to, because they're hearing the progress that what's going on in Connecticut and figuring out how they can help and looking at us as a model of, reopening. And, that part of it, as we've always talked about, is, helping get the word out for vaccinations, doing a vaccination clinic, whatever the case it is. So with regards to what other teams are doing, we don't know. We focus on Connecticut, but Connecticut's hitting a home run.
Governor, what is the assumption as far as vaccination rates on May 1st and then again on May 20th?
I think overall, we look at our vaccinations going up at about 10% a week. So far, we have not seen that slowing down at all. Whether we can keep that rate up through May 19th, time will tell. But I think that's the only assumption I've got. Josh, you have anything better than that?
Yeah, no, that's exactly right. I mean, I think at the current trajectory, even factoring for a little bit of slack in demand, we're optimistic that the people who are currently eligible, should be, around 70% vaccinated by the end of the month, and hopefully continuing to tick upwards from there. So, we expect to have very good coverage as we already do, and keep building on that over the next month. So we've got a lot of time between now and May 19th.
So, Governor, when did you make this decision? And again, when it comes to healthcare experts, other than Commissioner Gifford, I'm still unclear as to who you consulted with. You did have a reopening committee. Did you reach out to members of that committee, or was this all through Commissioner Gifford?
It's really David and Commissioner Gifford were the group we talked to. We spent an hour or two Sunday morning going over all the different iterations, where we were on vaccinations, and where we thought we could open safely, and think about the economy and knowing that the economy is never going to come back unless public health is front and center, and we wanted to get the right balance there.
Yeah, and I'll just add, Paz, the governor really has asked those two commissioners to really do the necessary research to inquire with their counterparts in other states to really look at the data and really come back to the governor with those answers and eventually recommendations for the governor to make a final decision, which he did. So it's not just a matter of just a small group think. It was these individuals as part of our team that we have working on these matters and really inquiring with individuals outside of the state function to really get to the answers that the governor was looking for.
Did anybody play devil's advocate at that meeting as far as what might be the downside of going forward?
Everybody did, Mark.
Yep.
You could always say, let's wait until we're 100% vaccinated. Let's wait till we have 0% risk. What's the harm in waiting another month? What's the harm in waiting another 3 months? So you have to make these judgments every day.
Thank you.
CT News Junkie.
Hi, it's Lisa Backus from CT News Junkie. I just want to recap. So as of May 1st, bars can open outside with no masks, and they can open inside on May 19th with masks. Is that accurate?
I think May 1st is inside with masks, outside, if you're sitting around outside, you don't have to wear a mask if you're having a beer.
Okay, so they can open inside with masks as of May 1st.
Correct.
Okay, perfect. Does anyone have any idea how many bars this is going to impact and or open up?
That's a good question.
I know the figures for restaurants have been tossed about, but
I got to get back to you on that, Lisa. Some, it's really you're able to have a drink without having a meal or having a food. That's what we've relaxed. So some bars started serving food. So it's not simply a matter of going to Wikipedia and looking up the number of bars. But I can get back to you on that if you want it.
I know Commissioner Lamont had estimated there were several hundred that had not opened at all because they were not able to or willing to serve food with alcohol. And just to be very clear, though, Lisa, on your question, the indoors versus outdoors part for bars, it really has to do with whether they're serving food with alcohol. So if they're not serving food with alcohol, they're not allowed to operate indoors. That's, as the governor said before, that's for outdoors. That's an option now. You can serve alcohol without food outdoors only.
Okay, that's what I was trying to clarify, so thank you, because I was unclear. My last question is, now, how does this impact the airport? Say, for instance, Bradley, if you're going to fly out. You wouldn't have to wear a mask at the airport as of May 19th?
As of May 19th, we're either going to have a mask mandate or guidance as regards a public venue like the airport. Let us get a little closer to May 19th to clarify that for you.
Okay, perfect. Thank you so much. I appreciate it.
The Hartford Current.
Hey, everybody, this is Emily Brindley from The Current. I would like to follow up on one of Paz's questions about who you spoke with about this decision, Governor. To clarify, it sounds like as far as the public health side, you only spoke with Commissioner Gifford. Is that correct?
Well, I will tell you, our team talks to the healthcare professionals across the state on a sort of regular basis. As regards who was at the table as we made the decision on Sunday, it was Paul and Josh and Deirdre and David and myself.
So no other public health or medical experts were specifically consulted about this reopening decision?
Josh, you want to speak to that?
I feel like this answer has been answered about 5 times on this press conference already. I think you've covered it, Governor.
If you could answer it again, I would really appreciate it. I don't think that there's been clarity on that yet.
I'll step in. There was clarity. I answered the question. The commissioner, who's our public health commissioner, spoke to her counterparts in other states to get the answers that the governor needed to be able to provide guidance to the governor, along with Commissioner Lamont, who did the same on the economic development side. It's the purpose of having commissioners and having a team to be able to get that information and properly brief the governor.
Okay, and I'd like to ask also specifically about the social distancing requirement. I spoke with a doctor from Hartford Healthcare who said that he feels like reopening can be done safely right now. His one caveat was that he doesn't believe that it's an appropriate time to remove the social distancing requirement. So, Governor, could you speak a bit specifically about why you're lifting the social distancing requirement on May 19th?
Yeah, May 1st, we're keeping the social distancing in place because I'm finding most of the, in this case, is mainly restaurants, have been very careful. And whether I say it's 6 feet of distance or not, they're making sure that they have enough spacing and have the mask requirement and keep the disinfecting in place so that people want to come into their restaurant and they feel safe doing that. And at this point, I think I'm going to pass over that judgment to the restaurants because they have pretty good judgment on how to do it safely.
And you talked about how all of this reopening is contingent on the metrics. So could you talk a bit about what specific metrics you're looking at, especially as we're moving from May 1st to May 19th? And if you could give some like a range or a sense of when you would start to consider rolling back or not continuing with May 19th, I'd appreciate it.
Yeah, I look at two things. I look at if I see a fast change in the infection rate, maybe the Brazilian virus is coming in. I see that reflected in infections. I see that reflected in hospitalizations. That would give me pause. If I saw something like Michigan or something like Idaho, that would give me pause. But right now, I feel very confident that we're doing the right thing because over the last 1 month, 2 months, and even longer than that, we've been on a pretty steady path with more and more people getting vaccinated and us keeping the infection rate under control.
And one last thing unrelated to the reopening. As you mentioned at the beginning, we passed 8,000 deaths today. I wonder if you could speak a bit about what that milestone means for the state.
I think that we had no idea of the scope of the tragedy that we were confronting a year ago. I think Connecticut and our region had much more understanding of it than perhaps some of the comments you heard coming out of Washington, D.C. And I think we as a state, we as a country have got to learn from the scope and scale of the misery and fatalities this has created and make sure that we are much better prepared and we take the early warning signals much more seriously next time than we did last time. Shame on us if we let this happen again.
Thank you, everyone.
All right, I guess I'm getting the signal here from Max. I'd just like to say two things. Tim, I really appreciate you being here. Steam Burgers, I got it. I really look forward to coming into the stadium. I look forward to events. I look forward to live audiences. And I'm not the only one. A country western star, Brad Paisley, has some comments on that as well.
Empty seats can't cheer. They don't tailgate. And they don't know fight songs. Empty seats don't sing during seventh inning stretches. And they don't know stats or superstitions. There's a soundtrack for places like this, and it isn't made in a studio. It's made by you. So when it's your turn to get the vaccine, be a fan. Take the shot. Empty seats can't cheer.
I'm not sure all your friends have, so tell your friends how important it is. Thanks, everybody.